Hello everyone, I'm Kim Bell from BRC TV 13. I want to welcome you to the 4th annual Heroes event. On behalf of Lehigh Valley Hospital Pocono and the Pocono Foundation, we want to thank you for joining us this evening. We hope this evening will not only touch you and as we honor our local EMS providers, but we hope this evening will serve as a clear reminder of our support, partnership, and companionship with our local EMS providers and how important their roles are in our everyday hero lives. With your continued support, we hope to continue this tradition and have this event every year because we want to honor our EMS heroes. So keep that in mind, and also keep in mind that 100% of all the proceeds go to EMS for needed equipment. And I'd like to thank our sponsors this evening for making all of this happen. First, Lehigh Valley Health Network, Ameriteam, Medevac of Lehigh Valley Health Network, Quick Med Claims, Team Health, Wawa Foundation, and media partner for tonight, of course, BRC TV 13. It's now my honor to introduce Elizabeth Wise, the president of Lehigh Valley Hospital Pocono, and she has some welcoming remarks.
Thank you, Kim, and welcome to all of you that are watching. And thank you for attending Lehigh Valley Health Network's Pocono Foundation's 4th year and first time virtually hosting the EMS Heroes event to celebrate and honor the extraordinary work of our local medical emergency first responders. Special recognition goes to those involved in the production of the event, as well as our sponsors, Kim Bell and Zach Booth of Blue Ridge Channel 13 for their generosity in filming and hosting tonight's presentation, the sponsors that Kim mentioned previously, the EMS Council, the Monroe County 911 Call Center, and of course the EMS agency leadership and crews of Bushkill EMS, Pocono Mountain Regional EMS, Suburban EMS, and West End Community Ambulance Association. Tonight, you will hear about some amazing stories and heartwarming outcomes. This is possible because of the work these men and women do. And many of you know that this has been an unprecedented year, and these were the first-line responders and heroes that responded to the community during the pandemic and continue to do so every day. The importance of this evening is reflected in the network leaders who have chosen to join us in honoring them this evening. Dr. David Scaff, Medical Director, Lehigh Valley Hospital Pocono Trauma Center. Bob Begliamini, President, Lehigh Valley Hospital Muhlenberg, and Senior Vice President of Operations for Lehigh Valley Health Network. Dr. Colleen Kennedy, Medical Director, Lehigh Valley Hospital Pocono Emergency Department, and Dr. David Burmeister, Chair, Department of Emergency and Hospital Medicine. And now it is my honor to introduce Gary Hoffman, the Director of Communications for the Monroe County 911 Control Center.
Night of honoring Pocono EMS Heroes celebration. I wanted to say, first off, that I'm extremely honored to be asked to participate with a few opening remarks for this well-deserved celebration. The spotlight tonight is on our own Monroe County Emergency Medical Services personnel. These heroes are particularly close to me in my role working for our County 911 Center. I'm very proud to say that I've known some of these folks for a long time throughout my 42-year career here, and they do some amazing things. These people are members of our elite force of frontline first responders who provide our county with basic and advanced life support services. It makes no difference if they're volunteers or paid. It's about what they do for each one of us every single day. These first responders are mothers, fathers, grandparents, and each call they respond to could be their last. Our emergency medical personnel respond 24 hours a day, 7 days a week, 365 days a year. They treat fellow human beings who are experiencing some of the worst times in their lives. They see many things that the average person never gets to experience. They deal with the stress of seeing individuals pass before their eyes, and for days and weeks afterwards, they search their minds by continuing to ask themselves, was there something that they could have done differently to change the outcome? Not all is bad, however. Sometimes they get to see a new life come into the world. So far this year, our 911 team dispatched these individuals to over 15,680 emergency medical services calls. That's an average of 70 EMS calls a day, which is really a pretty significant number. We have documented cases throughout the years where these folks have really saved someone's life by their actions. Without their intervention, by providing life-saving techniques, people certainly would have died. This past March, we all awoke to a new evil, a global crisis that's worked its way into our personal and professional lives. The COVID-19 pandemic has radically changed the way we live for the past 5 months and how we will live moving forward. So far, since the pandemic arrived in Monroe County, in late March of this year, we have dispatched EMS crews to over 474 COVID-19 calls for service. All of our EMS professionals, whether working in the streets or in a hospital environment, have all been dealing with this situation in many ways. No one knows the psychological toll this will have on these healthcare providers moving forward. Because of the dedication and commitment of these healthcare providers, they could be walking into a COVID-positive situation at any time. In addition, these first responders could literally carry the virus back into their homes and compromise the health of their own families. We have had real incidents where people have answered our dispatchers' pre-arrival questions, and when asked the question if they've been exposed to the COVID virus, with a no. But later, we found out that they said no because they thought either the EMS crew would take longer to get there or wouldn't come at all. We have all become overwhelmed with this situation, and we hope it would have run its course by now, but now more than ever, we cannot become complacent or let our guard down. This virus is not the only concern that our EMS folks face. So far this year, we've dispatched over 370 overdose incidents. These extremely high-risk situations pose a significant risk where our EMS crews could be seriously injured or even worse. The opioid crisis is real, and Monroe County has been feeling the effects of illegal drugs for quite some time. Our law enforcement community is working very hard to curtail the illegal action, but this is much bigger than all of us. To the providers, you have made your spouses, children, and parents extremely proud for the career you have chosen and what you do for people every day. All of you are deserving everything good that comes to you. Congratulations to all of you. You are a true inspiration to all of us. Please enjoy the evening. Thank you.
Thank you so much, Gary, for those heartfelt comments. Our first story tonight highlights the importance of teamwork in saving a loved one and how a family's performance under pressure brought about a positive outcome. I'd now like to ask Dr. David Scaff, Medical Director, Lehigh Valley Hospital Pocono Trauma Center, to introduce this powerful story about Pocono Mountain Regional EMS.
Because of the COVID-19 pandemic, this celebration has had to move online, and we have all had to change our lives in the past 6 months. You know, today, because we're online, I don't have to wear a mask for the first time in a long time. And I shaved my goatee off for the first time in 20 years, and my wife recognized a new husband. But these are all clear examples of how our lives have all changed because of the virus. The one thing that has not changed, that has remained steadfast throughout this whole pandemic, is the commitment of our EMS colleagues. They continue to put their own lives at risk every single day to help their friends, their neighbors, and their community. If anything, the virus has appropriately highlighted the incredible work that these frontline heroes do. I encourage all of you to talk with EMS provider concerning their profession. You will be amazed at the situations they face, the life-changing decisions that they make, and their deep passion to help their community. As the trauma director here at Lehigh Valley Hospital Pocono, I have had the privilege of working side by side with our EMS colleagues for the past 12 years. I have witnessed their commitment, their technical expertise, and their compassion firsthand. Without them, we would not be the highest level of trauma care here in Monroe County. To our EMS colleagues, from the bottom of my heart, I say thank you and I honor you. During emergency situations, you need to have a partner, a team of people working together to save someone's life. Each team member is critical to achieve the best possible outcome. Here is an example of people working together and the results that come from collective actions. Thank you very much, and God bless you.
I believe we actually looked at each other and said, this could turn into a code. And shortly thereafter, he did lose consciousness, and the family was doing CPR, which of course makes it one of the more severe calls that you can respond to. Someone's life is literally ending at that moment, and you have to respond to try to save them. Well, Michael and I were working a shift at Pocono Mountain Regional when we were dispatched to a call for a cardiac event, a 51-year-old man having chest pain. And then we were advised while en route that the pain was getting more severe, the patient was now unresponsive, and they were giving CPR instructions to family members.
We entered the residence through the main entrance. The son was doing CPR. We moved the patient down onto the floor. I asked the son to move to the side, and I started chest compressions while Brooke started the cardiac monitor.
So having an extra set of hands on scene, and especially on a call like that, gives us the ability to do multiple things at once. So that ultimately makes our job a little bit easier for a very stressful situation like that going on.
I would say the kids were very calm in manner. I know the son had said a couple of times, "Come on, Dad." I think even the daughter may have said that as well, which I think those things in the back of our mind kind of also made us want to do that just much better for this patient. Without him doing the compressions that he did, I think he ultimately saved his father's life.
We, after the first defibrillation, continued with chest compressions, continued to defibrillate him every 2 minutes if the rhythm was appropriate. And I started an IV. We gave him epinephrine, we gave him amiodarone, and this process continued for about 10 to 12 minutes until we noticed on the next rhythm check that he had what's called an organized rhythm. And in fact, he did have pulses that went with that rhythm. So that was excellent. He began to move his extremities. He had a good blood pressure. We were able to get a 12-lead EKG and confirm that he had in fact had a major heart attack. So we were able to notify the hospital that we had a post-cardiac arrest STEMI coming in so that they were prepared upon our arrival. I spoke to the wife and the son and daughter afterwards because I wanted to make them understand how important it was, what they did. I was so proud of the kids for responding, and I asked him, "Where did you learn to do such great CPR?" And he said, "I actually never learned, I just followed what the dispatcher told me." The daughter was on the phone with the dispatcher giving information. They were critical in their response. He had I believe a 100% occlusion of his LAD artery, had a stent placed, and was able to leave about a week later with his family, so that's amazing.
We've seen the concern in your eyes. You're scared, nervous, want to know if it's safe. The answer is yes. At LVHN, you'll see the extraordinary steps we take to get you the care you need safely. You'll see all our facilities are COVID safe, temperature checks for everyone, that we sanitize every surface. And yes, you'll see that masks are required. What we look forward to seeing is relief in your eyes. Lehigh Valley Health Network. Your health deserves a partner.
Welcome back, everyone. Now, it's sobering to think about this fact. Some patients don't recognize the signs of a critical situation, but a fast response and a calming influence can change the outcome. Now, I'd like to introduce Robert Begliomini, President, Lehigh Valley Hospital, Muhlenberg, and Senior Vice President of Operations at Lehigh Valley Health Network, who will bring us our next story about Suburban EMS.
It's why we are here. It's what drives us to do this job. I hope we made a difference. This is what you will hear shortly from some of your own. Imagine your day, normal routine, everything going usually as planned. Suddenly you know something isn't right for you or for someone you're with. You call the lifeline that is 911, and from there, the next steps of the unknown are very, very scary for many of us. For you, our cherished EMS providers, I know most of you could write a book on your unbelievable and heart-wrenching experiences. Never knowing what you're going to walk into when you get that call. It could be chest pain, it could be an injury, an accident, a small child, suicide, and always the potential for danger. Fighting through the mix of emotions you go through every day is a testament to your dedication and passion for this work, and for that, our entire community is thankful. You are one of a small group of caregivers unlike any other. Most of us could never do your job. I heard EMS is not a job. It's a dedication to their fellow mankind to make sure they would do everything possible to save your life. Please know how much you are appreciated by the community for all you do every day, no matter the conditions. Speaking of conditions, during this pandemic, you and your leaders have shown bravery and resiliency to care for this community under the most unprecedented conditions you will likely ever face, placing yourselves at risk as no one knew just how to handle this virus when it first appeared. Again, my heartfelt thanks. So this story is one that happens all too often when we least expect it. You will see and hear the anxiety of Maureen Vecchione as she tells the story of her emergency and the expertise and quiet confidence of this remarkable Suburban EMS team. She says, I knew, they knew exactly what to do. This duo understood the need to care for both the physical and emotional impact of the emergency care they provided and have forever touched the lives of Maureen and her family. Congratulations to this great team.
And the next thing I know, I woke up in the intensive care section. I told my friend Ellie, I said, here's my phone. Call over to the church. Don't say anything else, but just put me on the prayer list. But don't tell them what's going on. Well, that morning, I actually took one of my friends over to Young's to get compression socks. She was 86 years old. We went to breakfast, got home maybe, 11:30, and it was a day in April that was a little warmer than it should have been. So I said, I'm going to go out in the garden for a little while. And I went out in the garden, maybe 10, 15 minutes tops. And I started to get really overheated, started to sweat, and I was saying, are you stupid? Go in the house. It's too warm too soon, go inside. But once I got in the house, I couldn't cool down. And the next thing I know, I wake up and I am on the bathroom floor. I get up, I'm a little shaky, and I look in the mirror and I have this is all cut, this is all bleeding. And I called a friend, and so they came over and they assessed what was going on. And I said, Ellie, I'm overheated, or what did I eat wrong? And she looked at me and she said, Mo, we're going to call EMS because I think you're having a heart attack. From what I understand, which I didn't get till much later on, another 30 minutes and it would have been a problem. The technician walked in to the implant, and I can't even explain the feeling you get. He knew exactly what to do, and you had a calm that just went over your whole, okay, I'm just gonna let them, do whatever. And they couldn't have been better. Relax, it's going to be okay. They're going to be waiting for you when you get there, you know. And it's just, they were great.
You know, it's part of the job to try and keep the patient calm.
Yes.
Especially if you feel that they are having a life-threatening event. The worst thing to do is get them excited or upset. Even if you aren't calm, you gotta at least look it.
Basically why we're here. It's what drives us to keep going with this job, I think. It's just to know that we hopefully made a difference and that it was a good outcome.
This is a marathon, not a sprint. But we need to go back to work. Our kids need childcare. We need groceries. And sometimes we need a hug. But we also need to be smart. When you have to be around others, you need to wear a mask. It's clear that people without symptoms can be a carrier and spread the virus. So cover your nose and mouth, and let's work together to reach the finish line safely. Our community's health depends on it. Lehigh Valley Health Network. Your health deserves a partner.
Welcome back, everyone. Lehigh Valley Hospital Pocono was recognized by the Joint Commission in March 2020 for the speed and efficiency with which they get patients into the cardiac cath lab. That's very important when seconds matter. I'd now like to turn it over to Dr. Colleen Kennedy. She's the medical director for Lehigh Valley Hospital Pocono Emergency Department. And she's going to demonstrate this importance as she introduces the next video about Bushkill Emergency Corps.
I'm honored to have been asked to introduce these heroes. I would be remiss if I did not recognize the extraordinary times within which we are all working. An already stressful job has been made 1,000 times more so by the onslaught of the COVID-19 virus. While we are here to recognize the EMS providers in this case, we should also recognize all of our pre-hospital personnel as heroes. The relationship we have with our EMS responders is a powerful one. In a job where every second counts, we often reference the golden hour of trauma, that time is brain and time is myocardium. We know in the emergency department what happens from the moment 911 is called to the time a patient gets to our doors can be the difference between life and death. Our EMS responders are an extension of the ED, and they work beside us as an integral part of our team. It is critical that our EMS responders are able to triage, assess, and initiate treatment after making contact with the patient under often less than ideal conditions. They can give life-sustaining medications. They can secure an airway. They can diagnose a stroke or heart attack. And those skills are critical to activating the appropriate team at the receiving hospital. We rely on our EMS colleagues to assess the patient and to accurately communicate the situation to the staff in the emergency department. This allows us to be prepared and to have all the necessary medication and equipment at the patient's arrival. Oftentimes, the trauma team or nurses from the cath lab are in the emergency department awaiting the patient because of EMS. For EMS personnel, there is no such thing as a routine day. This was never more apparent than in the following story, when a routine morning became anything but routine.
He was sitting on the couch like this. He said, "I'm not gonna make it, I'm not gonna make it. Lord, you can't take my husband yet," you know? But then I thought if it was his time to go, I thought I better wake my daughter up so she could say goodbye to her father. I'm sorry. When he told me don't wake her up, but I didn't want, if he died that night, I didn't want her to see him going out the house, passed away.
Well, I got up, I guess it was Wednesday morning, and just like any other morning, unfortunately I'm a smoker, so that's one of the drawbacks. That's probably why I wound up where I was. So I go have a cigarette, put my cigarette out. As I'm putting my cigarette out, I felt like, I don't know, strange, like numbness across my chest. And I said, oh man, that's not good. First thing I did was put an aspirin in my mouth, under my tongue, grabbed my phone, called 911. I told them I'm having a heart attack, I need an ambulance, and gave them the address.
So when I first got there, and with the way he was presenting, it was very, very urgent that we act quickly, act aggressively, put fluids in, start aspirin. We gotta move, and we gotta move now. Like, there's no waiting.
I mean, but he still had his composure, he was still joking around. You know, he was, you know, he really was funny, considering he was having a heart attack.
Right.
They were phenomenal, like this. I mean, they were just so good. We even had ice in our driveway.
An ice storm the night before.
Yeah.
They even had salt.
Yep.
They were so prepared, it was ridiculous.
They brought such peace to the situation. You know, like I felt with them there and the way they were reacting that he was gonna be all right.
Oh yeah, they had me as calm
Yeah,
as
I mean, they just
be.
brought such peace and calm. I was surprised he was already in the cath lab. Like, everything was just like boom, 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 boom.
By the time you got to the hospital, I was almost ready to come home.
Yeah, I mean, everything just flowed like so smooth.
No, I'm telling you, it was for a bad experience. It went as good as it could.
Yeah.
I think there was more reinforcement that we were like, we're gonna get you there.
Yeah.
You know, you're gonna be okay. Like I think he was nervous too. You know, knowing that he knew he was having a heart attack. Like he knew it was happening. We're here to, you know, help people that are in need and that are looking for, I guess, what's the good word? You know, a savior, but
a best friend on your worst day possible.
Yeah, exactly. That's a better word to use.
That's how I look at it. You're their best friend on the worst day possible.
Lehigh Valley Health Network Medevac delivers critical care 24/7 by air or ground. Each ambulance and helicopter is staffed by a specially trained critical care nurse, paramedic, pilot, or EMT. Ground or air, same level of care. What truly sets us apart are our people and our passion for better medicine. When minutes matter, LVHN Medevac is there, delivering critical care, saving lives.
Each year, we are so grateful for the participation from our elected officials who have joined us to present awards to each of the 4 EMS agencies. This year has been much different for all of us, and in light of the
Thank you so much, Elizabeth. I would now like to introduce Dr. Jonathan Goldner. He is an Associate Senior Medical Director for Lehigh Valley Hospital Pocono, and he's going to talk to you about why we run this event, the partnership that is shared with EMS colleagues, and the support for each other during this difficult time. Dr. Goldner?
Thank you, Kim. Well, what amazing stories we heard tonight, and it's very, very impressive what our EMS teams do for our community. This is our way of saying thank you, and it's so important that we really take that time. They obviously don't get enough thanks. I know they don't do this for the pay, that's for sure, but I want personally to take this opportunity to say thank you for all you do. I know that every member puts in long hours training and meeting the needs of our community. We know that you're dedicated, we know that you care, and we also know that you rarely get the amount of thanks that you deserve. So on behalf of the Lehigh Valley Health Network, the staff at Lehigh Valley Hospital Pocono, our community, and myself personally, I just wanted to thank you for your time, thank you for your dedication, thank you for your caring, your compassion, your empathy, and your devotion to patient care. Thank you for taking the time away from your families. We know this is a job that's 7 days a week, 24 hours a day, 365 days a year. And thank you for risking your safety. Thank you for your bravery and for your commitment. To all those at home as well, thank you for your donations. Thank you for everything you do for our health network and our community and for our hospital here. We could not do this without you. I thank the team here for putting all this together because it really showcases what EMS does for our community. So again, thank you very much.
Thank you so much, Dr. Goldner. Well, our final story of the evening is a testament to one man's will to survive and a miraculous effort and the good timing that provided him and his family with a second chance at life. I will now introduce Dr. David Burmeister, Chair of the Department of Emergency and Hospital Medicine at Lehigh Valley Health Network, who will provide a lead into our final story about West End Community Ambulance.
When you listen to these stories, you can really understand there are common themes here, right? And the one that comes to mind is teamwork. Teamwork never fails. It never fails in many, many ways. We don't always get the result that we want. We don't always get exactly what we want when we work together as teams. And we learn constantly whenever we're working together as teams. But the one thing that it does is it uses our collective strengths, and it allows us to work together to perform a common task. In the EMS community, that common task is many times saving a life. It doesn't only make us better as a person, but it also makes us better as individuals and strengthens our relationships. One of the other most important elements in our EMS community is critical thinking. This case will exemplify what critical thinking truly means. How many times have our community, whether it's on the internet or whether it's on television or whether that's in a book, say, call 911. When you don't know what's happening to you, when you don't understand exactly what type of medical issue that you're having right now, call 911 is your answer. And what that means is that many of our EMS providers are going into situations that they truly don't have a lot of information about. They have to utilize that critical thinking constantly in every single thing they do, whether that's a chest pain, whether that's a shortness of breath, or whether that's a significant trauma. One of the other things that strikes me with all of these stories is how difficult of a job our EMS providers have. They have to take into consideration all of the outside information in a very short period of time and to stabilize our patients and get them to where they need to go. And in many times, providing life-saving treatment in a very short period of time. In closing, you will see how this story exemplifies teamwork, critical thinking, and how important our EMS providers are to our community. Again, thank you for supporting our heroes.
They did everything perfect for me. I mean, I wouldn't be here if it wasn't for them. And I still have my leg because of them. I mean, it was just a normal day, and we were just cutting a bunch of trees down. I cut the notch in it, and then I started doing the back cut. I heard it pop. Something just didn't sound right to me. And I actually set the saw down and backed away from the tree. And then next thing I know, I was sitting on the ground and I look over and my legs just blown wide open. I had a sweatshirt on exactly like this. I tied it around my leg in a tourniquet as tight as I could. And then I had my cell phone on me and I called 911 first. I got a hold of someone there and they were sending somebody out. First they sort of stabilized everything and then they worked on getting the tree off. So they actually used my chainsaw to cut the tree off of me. I just remember them, they're trying to get IVs in me and they said my veins were flat. So I lost about half my blood.
These are the two people who responded to your call. They saved
Hi.
your life.
How's it going? You. Pretty good. How are you doing? I'm still here. Both my legs are...
2 legs. It was an oh crap call up in the woods. You know, that's not easy access.
A lot of split-second decision-making. You know, he was losing a lot of blood, but his leg was also pinned under a very large tree. You could see that it was broken in multiple places. And then the fire department, the teamwork was just seamless. You know, they carried their chainsaws up, they cut them off. We put them on a backboard, tried to get them out of the elements, kept them warm with a blanket so the wood chips weren't blowing all over them from the chainsaws.
I mean, thank you. I mean,
I'm just glad you have two
Just glad you're
legs.
okay.
Yeah, we don't usually see outcomes like this.
Yeah.
It's really good.
I'm glad you can.
Yeah, me too. Me too.
I know my wife is.
Yeah.
These stories really are life-saving, and they represent just a small sample of the work that's being done daily by our local EMS providers. Congratulations going out to Pocono Mountain Regional EMS, Suburban EMS, Bushkill Emergency Corps, and West End Community Ambulance. They are being honored here tonight for all of their amazing work. It's now my honor to introduce Nick DeWitt. He's the president of Monroe County Ambulance Association, and he's going to say a few words on behalf of his partners and colleagues on the front lines.
I just wanted to take this opportunity to thank the Lehigh Valley Hospital Pocono leadership and also the foundation, all the work that goes behind the scenes for these events every year. These events continue to recognize my EMS colleagues year after year and all the hard work that they provide to the communities and continue to provide, especially through a pandemic like we're currently facing. So again, thank you. I hope everyone had a great evening, enjoyed their time tonight, and I pray that my brothers and sisters continue to be safe and healthy out there on the front lines. Thank you again to Lehigh Valley Health Network.
Thank you so much, Nick. And on behalf of Lehigh Valley Hospital Pocono and the Pocono Foundation, I want to thank you for joining us tonight. And I want to tell you it's been another year and another wonderful group of EMS providers that are being honored. So this evening is only possible because of the unwavering support of our sponsors, donors, physicians, and everyone who purchased a raffle ticket for this wonderful event. And speaking of tickets, Elizabeth will now join me to pick the winning raffle ticket for this year's event. So Elizabeth, pick away.
So before I do that, I have to have a little bit of a teaser and a thank you. But sincerely, this is a new world for all of us going virtual. And I could not have been more pleased about how this event turned out. I want to thank all the sponsors, thank Kim, thank Zach. I want to thank all of the presenters. And more importantly, I want to thank our first-line responders from our local EMS agencies. And finally, I want to thank our patients and our community who put their trust and care, and we are honored to be able to provide the service for you. So now I'm thrilled to draw from this. I'm hoping my name is here at least 300 times, so it won't be a surprise, but I can't pick my own name, so I'm gonna run it around a little bit and pick the following names. From West End Ambulance, William Schrack. So congratulations. Woo! And thank you to all for joining us for this wonderful event.